the whole differentiator here is that it was that OxyContin was non-addictive because it had this continuous release and it didn't create the peaks of euphoria that a immediate release drug would. How did they present this to the FDA? Did they present it with any data to back it up? And why did the FDA greenlight this thing without any data if it wasn't there?
That's one of the most, fascinating and also depressing aspects of this story, in the sense that, we all would like to think that, the FDA, it's like they're into science, they make decisions based on science. In this case, there was not a shred of science to back the theory that that people who abused drugs would be less attracted to time release drugs than they were to immediate release drugs. Because as you say, people who like to get high from drugs want a quick hit, right? They want to feel it right away. They don't want to hang out for 4 hours waiting for this drug to kick in. So, the argument from Purdue was that, well, they're going to stick with immediate release drugs like Vicodin or Percocet because it's going to take a while for them to feel the effects of Oxy. But there were no clinical trials done to prove that. Clinical trials involving opioids are very difficult to run for a variety of reasons. And so they just promulgated this theory. And there was essentially one person at the FDA, a drug reviewer by the name of Curtis Wright, who basically fell under, the spell of this theory that Purdue was promoting, and I believe also under the spell of Purdue in terms of their ability to charm him, and greenlit this thing. And once, gave them the ability to use a marketing phrase, which was something to the effect that, it is believed that time release drugs are less prone to abuse than immediate release drugs. But Purdue then took that phrase, which was just said, it is believed, and turned it into a statement of fact, and basically began promoting it as less prone to abuse and addiction than competing painkillers.
You said just a minute ago that people who like to get high, but the problem here is that people who didn't know that what they're taking was wildly addictive were being prescribed OxyContin. Now, I've taken Vicodin for dental work, and I remember feeling so euphoric. I gave a talk at UCLA one time, and I was on Vicodin. And I remember thinking, I am bulletproof. I cannot lose today. This is exactly how I should feel every day. And then I thought to myself, I wonder why my dentist only gave me 4 of these pills.
Yeah.
Like these drugs are incredibly powerful. And so to claim that they're non-addictive without any science is kind of bizarre. How soon does it take for Oxy to start wreaking havoc on the people who took it?
Almost immediately. I mean, the startling thing, and it was only later when I was able to receive, was given this confidential government memo that was prepared for the prosecution of the Purdue Pharma executives, that I realized that the company was receiving reports of the drug being abused almost from the second it emerged on the marketplace. In fact, the company also had received reports, and I kind of document these in Painkiller, that the predecessor drug, OxyContin, was also being abused and also being sought out by drug abusers, but they suppressed that information and never gave it to doctors and never gave it to the FDA when the FDA was considering the application to get, special status for OxyContin. Had they done so, I don't believe the FDA would have ever given them this information. Had they shared the information they had on OxyContin with doctors, they never would have accepted the claims being made for OxyContin. And in some ways, the story of OxyContin, is also the story of this company's suppression of science and lies even before OxyContin appeared on the market.
When Tylenol had the big crisis back in, was that the 80s, I guess, it was made by Johnson and Johnson, a public
Right.
company. And the CEO, I can't remember his name at the time, is sort of legendary in management lore for taking responsibility and taking the pain of a huge hit to their profits in the short run to protect the brand. Do you think if this had been happening at a public company, we would have had a different outcome?
I have no doubt about that. One of the things that I've been struck by and have thought about as the whole, as some of your listeners may be aware, Purdue Pharma is now in bankruptcy because of the large number of lawsuits it's facing from states and municipalities and individuals related to OxyContin. And throughout this whole process, the Sackler family and the members of the Sackler family, the descendants of the original founders who continued to run the company, have all claimed, ignorance of this. We had no idea that this was going on. Had we known, we would have done something different, blah, 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 blah. Look, I don't know exactly what happened, but here's what I do know is that at no point during the heyday of Oxy, which was, the early 2000s into almost the mid to late 2000s, when it was public knowledge that the abuse of this drug was rampant, that large quantities of it were being diverted onto the streets, so on and so forth, did Purdue Pharma ever stand up and say, you know what, we're stopping sales for right now. We're going to pull back on this. Or, you know what? We believe that 10% of this drug is being diverted for illicit sales. So we're going to earmark 10% of any proceeds we receive for drug treatment or for whatever the case may be. And I often think, how much would how much would we as a society benefited from that? But even more significantly, to your point, would the Sackler family now be considered pariahs if they had stood up earlier and acted in a way that would have made them a teaching lesson for business schools? They certainly have become the teaching lesson for business
Not,
schools and the other kinds of schools, but it's
yeah.
certainly not the one they ever imagined themselves being.